Hi, my name is Tatum Komlodi, and today I will be talking about hip strengthening to treat iliotibial band syndrome. ITBS, or iliotibial band syndrome, is a condition where friction of the iliotibial band rubs against the lateral epicondyle of the knee, which causes chronic pain typically. This can be seen most frequently in runners, cyclists, or anybody who repeatedly flexes and extends their knee, because that flexion and extension is happening repetitively. The iliotibial band is rubbing repeatedly against the lateral condyle of the femur. There is no current best evidence that supports one specific type of treatment. The standard treatment has been stretching and foam rolling, more soft tissue focused, although this has not shown to have great results. So this paper is taking a look at hip strengthening in order to treat ITBS, and that leads us into our clinical questioning of, does hip strengthening treat ITBS more effectively in runners than traditional stretching intervention alone? I used a couple different search engines to run the search strategy on this. I used PubMed, ScienceDirect, and Trip were the main three. I had a variety of search terms that are listed in the paper, and ultimately I had very broad inclusion criteria just because there is such little research done on this paper. But most notably, everything had to be done within the past 10 years. It had to focus on hip and knee strengthening for IT band syndrome, and the participants had to be adults, so we weren't looking at children or any other intervention type. In conclusion, there was moderate evidence that supports the use of hip strengthening in the treatment of ITBS, although this is based on current research, and like I said, there's very little evidence out there right now, just in general. So my recommendations based on the literature were hip strengthening, but also using a combination of myofascial techniques such as massage or foam rolling to decrease the initial pain, and then working on that strengthening to prevent the chronic use of that pain.